with all of you and talk about the pelvic floor. I will, like, warning, we're going to talk about adult and female anatomy and using proper terms. And we're going to dive deep into a whole bunch of things. So if you have littles, if you need to put headphones on, or if you're watching the replay, just a heads up here, adult conversation as we dive into this. And just a quick medical disclaimer too, that the information that we present here, it's not intended to replace a one-on-one physician with a healthcare professional. It's not medical advice. I'm sharing from my own knowledge and information and research, and really encourage you to make your own healthcare decisions with your research and partnering with your doctor. And now that we got that out of the way, we're going to dive in. And I like to start actually with a whole discussion about Bertha. Bertha is my pelvic floor model. Can you guys see me again? I think I turned off the slides. Okay. So this is Bertha. She loves to show up and share every now and then because I'm a visual person. So this can be really handy. But when we're talking about pelvic floor health, we're talking about all the things that are happening in this very small area here. There's a lot that's going on. So men have pelvic floors too. We all have a pelvic floor. It's actually a network of ligaments and muscles and connective tissue, and it kind of acts as a little hammock, if you will. So we've got all of these muscles and ligaments, and they support and hold up the pelvic organs, including the bladder and the rectum, and in women, the uterus and the vagina. And you may wonder, because we have a lot happening here. So we've got the uterus and the vagina, we've got the bladder, as we mentioned, we've got the colon and the rectum. And this is why there's a lot happening in this tiny little space. And we have a lot of doctors all kind of focusing on this area. Your OB-GYN, your GI doctor, your urologist, a lot of things happening here. It's a really important area. And the pelvis is also an area where we tend to hold trauma, where we may have a history of sexual trauma or abuse, big emotions can happen. It's a safety area. If we do not feel safe, we're going to close off. We're going to tighten up the muscles of the pelvic floor. And there are superficial muscles as well as deep muscles. And these are under voluntary control, which means we can contract and relax them at will, even though we may not be thinking about them very often in our day-to-day life with this. But they kind of stretch, think of this like a little hammock, a little trampoline, and they go all the way from the pubic bone in the front, and they wrap around and go all the way to the tailbone in the back. So we've got our big innominate bones, kind of our pelvis bones here. Your hip is coming in through here like this. And then we have this big triangle bone here in the back, our sacrum, and then that little bitty coccyx tailbone. And what makes things even more interesting is we have some muscles of the pelvic floor that actually attach to the hip. They're external rotators of the hip. So there's a lot happening in a tiny space. And I share this because people who may have a history of hip surgeries, I've had 8 hip surgeries for adult hip dysplasia, or people who've had total hip replacement. They may have surgery and then start to notice differences with bowel and bladder or pelvic pain or issues. It's all related here. So it's very important, I think, especially as women, that we have knowledge about this and just a basic understanding to kind of help us with this here. So we've got superficial muscles, and we'll talk a little bit about our external female anatomy, because as a pelvic floor PT working in the clinic for several years, I noticed a lot of us aren't even aware of our own female anatomy. So I think it's really important. We're going to have our own little fried green tomato moment where they take out the mirror. I encourage you to do it. I really do, for your health. But we have the clitoris here. Very, very important for all of these nerves. It's very sensitive for orgasm, which is actually really important for our overall health as well. We have our urethral opening where we pee out of, that little opening here. We've got the vagina, and then we have the anus. So very important. If we're just looking at external anatomy, that's the vulva. Outside vulva, inside that little muscular tube, vagina. And what we want to know, I think it's important to just have an understanding and check that from time to time so you can tell if something is off, and just having a basic understanding of these, because it's really important, because they control a lot of stuff. The pelvic floor is holding up all of these organs, And it's also helping with the control of the release of our urine, of bowel movements, if you're passing gas. And the pelvic floor is also affecting in our pelvic floor health, sexual health and function, orgasm, and being able to, that this is all working well is really, really important. Also important in men, because men have pelvic floors too, important for erectile function, ejaculation. In women, we have voluntary contractions. And think of, especially if you're maybe having a little bit of leakage with maybe coughing, laughing, jumping, sneezing, this any kind of increased pressure in the pelvic floor. And the reason is there's kind of a synergistic, they all work together balance that happens. So we have pelvic floor on the bottom, we have our diaphragm up here, we have our transverse abdominis, our core over here, and then we have back extensors. And they all kind of work together. And we'll talk more about this in detail, but they are stabilizing your abdominal muscles, your spine, and things like, for example, during pregnancy and childbirth can cause a little bit more laxity here. If we're straining or pushing on the toilet, or we have chronic constipation issues going on, that can cause things to flare up a little bit. And by the way, we have products that help with constipation. It makes a big, big difference here. Chronic coughing, heavy lifting, high impact exercise, age, obesity, all of these things can make these muscles looser or affect the muscles of the pelvic floor. And you may have heard of Kegels, strengthening exercises. I was talking to somebody and they heard about this class and she said, "Okay, I'm doing my Kegel because of you, Laura." Like if you're talking about pelvic health, I better do this. And a Kegel is where we tighten up the muscles of the pelvic floor and we work on strengthening it. But here's the thing. These muscles, just like muscles in your neck, in your shoulder, in other areas of your body, they can actually go into spasm. And just like we may, maybe you go see a massage therapist or somebody and kind of have them work on those spots, these muscles can get tight. So I share this because some people may hear, oh, pelvic floor muscles, Kegels, okay, and they may just on their own go home and start doing a bunch of Kegel exercises. And the challenge is, and that may be great, they may be fine with that, but some people may notice, and I'll hear people tell me this, they'll be like, Laura, I heard about these Kegel exercises and I started doing them and they made my leakage worse. Or they made my pelvic pain worse. Like, what is the deal? What's going on with that? So if we try to strengthen a spasmed muscle, it's going to make the spasm worse. So if that is the case, I want you to stop. Don't do any more Kegels and wait and see a pelvic floor physical therapist. We have special training in this specific area to help with these things. But that being said, I think it's important to know the basics of a Kegel. And it's kind of like you're pulling, because a lot of people will bear down. They'll push down and out like they're trying to have a bowel movement. And with a Kegel, you're actually pulling up and in. So it's a tightening up and in. The best way that I've heard a pelvic floor PT describe it is kind of silly, is imagine if you were trying to drink a thick smoothie out of a straw. And now I want you to try to think about doing that vaginally. Like you're going to kind of tighten up, or you can think about stopping the flow of gas, or if you're sitting on the toilet and you're peeing, stopping the flow of urine. I don't actually want you to do that. I have some people like maybe do that like once a month, maybe to just check on your pelvic health, but it's not great to stop and start the flow of urine. We'll talk more about that too. We'll talk about proper toileting techniques, but just some good kind of overall. Or you can think about like walking into cold water, ooh, like tightening up, or it's that pulling up and in that we're after. Even better if you can pull your transverse abdominis in with this, because we talked about this lumbopelvic brace and how it's all related. So a great cue to do that is to think about zipping up a tight pair of jeans. You know how you have to like pull in just a smidge and kind of to pull up? So one of the ways that we can combine this, and you can actually play with this, especially if you're somebody that maybe coughing, sneezing, laughing, jumping, we get a little bit of urinary leakage, is I want you to think about that. It's called the knack. And this is where we actually train that mind body. We get the brain involved here with getting those muscles to engage a little bit. is thinking about doing that Kegel, tightening up like you're zipping up that tight pair of jeans, and then you practice coughing. So you've stabilized the brace and then you just or do your sneeze. So the more that we practice this, the more that it will become automatic, that we're not just taken by storm if something sneaks up on us and we have to cough or sneeze or are in a situation. But that can be a really powerful tool, just very, very basics to help people with some of the things related to pelvic floor health can be really great. But that is called the knack. Little thing to practice. If you're just brand new to Kegels, one of the best ways to start that exercise is we want to eliminate gravity a little bit to make it a little bit easier. Because if you're doing them sitting down or standing, we've got gravity fighting us. So try laying on your side or laying on your back and then practice doing your Kegels there and see how you feel. Again, listen to your body. If you get increased pain, increased urinary leakage, if anything here makes anything worse, I want you to go ahead and stop. But you can work on gradually strengthening. So maybe you start with 5-second holds and then you just relax. The most important piece is the relaxing. And just in bringing awareness to our pelvic floor, a lot of people notice they squeeze their glutes all the time. Like they're squeezing their bottom all the time, walking through life. So it's also important that we're relaxed and you know what that feels like, that you know what a contraction feels like. You can take a deep breath and you know what a relaxed pelvic floor feels like. I can tell you if you're a type A personality, maybe you're one of those like perfectionists and people pleasers and we're like high achievers and like usually our pelvic floor is pretty dang tight. So this could be kind of a good thing to start checking in and just noticing. But you could start with 5-second hold. You could progress to a 10-second hold from there and just kind of play with it a little bit. There are certain bladder irritants. So if you do struggle with a little urinary leakage, incontinence, maybe you have frequent UTIs or things, coffee, alcohol, citrus, chocolate, and carbonated beverages can be bladder irritants. So they can kind of irritate the lining of the bladder and kind of make it spasm, and then we can have some issues. So we want to be drinking a lot of water. The nice thing is our citrus essential oils don't do that because they come from the rind, not the fruit. So if somebody struggles with citrus, they could still do lemon or lime essential oil, things like that in their water, which is really great. But this is not for everybody, but for some. I had a client that I was working with in the clinic and she was living on Dr. Pepper. And we were working with pelvic floor PT. And if she didn't drink the Dr. Pepper, she was good. She wouldn't have any leakage. But as soon as she had a Dr. Pepper, it was a bladder irritant for her. So these are just things to kind of be aware of too, and know that what we eat and our nutrition does also affect our pelvic floor a little bit. They kind of go hand in hand. But I thought having Bertha here would be pretty handy. And then we can kind of jump back into the slides and talk a little bit more about proper toileting techniques, a lot of things to share here. And this is a big one that I wish they taught about in school. Let's see if, whoa, can you see my slides again? It's always a little dicey when you go on and off the slides. Okay, so if I want you to take away one thing from our time together, it is this. When you have to go to the bathroom, for the love of all that is holy, please go to the bathroom. And there was a sweet friend of mine, we were hopping on a call to talk about the Terra Talk and convention, and I was so proud of her. She texted me this and she said, "Hey, I'll be on shortly. I'm just using the bathroom real quick." And I was like, "This is good. This is important. Please go to the bathroom." So the number one professions that have urinary incontinence and leakage is nurses and teachers, because they cannot go to the bathroom when they need to go to the bathroom. They have to hold it. So this is such an important thing. If you have to go poop, go poop. If you have to go pee, go pee. And it's part of tuning in and listening to your body. But when you're straining or holding it all day or holding it for long periods of time, not great for your pelvic health. Can lead to pelvic floor spasming and dysfunction and constipation and UTIs and a lot of things. So start to listen to your body. If you need to go pee now, go pee now. We'll still be here. There will be a replay for you, but this is a really important habit to get into with your pelvic floor. The other thing about going to the bathroom is I want you to sit on the toilet. And people are really freaked out about this, especially in public restrooms. They don't want to sit on the toilet. They're like, germs. If this is you, I see you. I want you to take your On Guard hand sanitizing spray and spray the toilet seat down and then wipe it down. and sit on the toilet. Because as we talked about with these muscles, in order to pee or poop, your pelvic floor has to completely relax. But if you're hovering over the toilet seat, like you're kind of up here, woo, you're contracting everything. Your core's contracting, your legs are contracting, your glutes are contracting, and you're now telling your body, hey, go pee, but everything's tightening up. So I want you to actually sit on the toilet. We want to avoid straining or forcing urine. Ideally, be off your phone. I know that's a big ask. It kind of seems like if you're not on your phone when you're on the toilet, you're basically meditating at this point these days, but that would be a really good thing to do. And I'm also a really big fan of the squatty potty. So if you don't know what a squatty potty is, they have these everywhere. They got them at Sam's, Target, all the places. They fit over your toilet, and then you put your feet right here. So it props your knees up so they're over your elbows a bit. Well, it props your knees up so they're over your hips. So when we're sitting on the toilet, I only do this for you guys, by the way. This is how much I love you. We are mimicking sitting on the toilet, but you've got your squatty potty, or if you're at a hotel, flip the trash can over and put your feet on top, or have some big books in the bathroom. People will think you're super nerdy because you read all these cool books in the bathroom. And then put your elbows on your knees, and you're going to take some nice, slow, deep breaths, and you're just going to relax. But a lot of us are trying to force, push. We're like, we only have 10 seconds to go to the bathroom. Like we're running. We're doing all the things. So it's real important to allow that relaxation to happen. Big, big thing. So pee when you got to pee, poop when you got to poop. And then I want you to actually sit on the toilet. Very important. And I always have people fight me on this and say, Laura, in other countries, they squat. Yes, they go into a full squat, booty to the ground squat, not this hovering stuff that we see here. There is a difference with that. So if you can do a full squat, some people can do that up on the toilet. Great. Go for it. But this, I've had patients who had chronic UTIs, and just starting to sit on the toilet and go to the potty and things were helpful in clearing this up. So I cannot emphasize this enough. It's a really, really big deal on how to go to the bathroom. If you are having a pelvic flare, and this is pelvic pain, things going on, maybe you just had a baby, maybe you're in postpartum and everything is real tender and sore, or you're having pelvic pain, pelvic discomfort, you can add a drop or two of our peppermint essential oil into the toilet. Hear me on this. Do not put this on the vulva. Peppermint's very cooling. That's not going to feel good straight up. But into the toilet water, and then you sit down, and because peppermint is so cooling, it's going to help relax. This is really great. This is a great trick too to help relax your pelvic floor. This is a great technique if you have littles that are potty training, to kind of help with that. Like this is an awesome, awesome tool. Use your peppermint essential oil to really help. New mamas, postpartum, anything like that. This is going to be a really great tip. For bladder support, if you're somebody who maybe you have to get up in the middle of the night to pee all the time, or maybe you do have a little bit of urinary incontinence or leakage, cypress and juniper berry, two very, very powerful oils to help support pelvic floor and pelvic health. And you can make a roller. You could do 15 drops of each, roll it over the bladder, so lower abdomen area. Great. If you've got little kids that are wetting the bed, great one to do with them. Put that on before bed time. Really, really great support. And then this is a great one for pelvic discomfort. So maybe you are struggling with pelvic pain, pelvic flares, just had a baby. There's some really interesting research about this combination to help with yeast, to help with postpartum, to help with tearing, maybe had an episiotomy or tearing of the vulvar tissue or anything after labor. Labor's a big deal. Like mamas, I see you. That's a really big deal. In Europe, after you have a baby, everybody goes to pelvic floor PT. It is automatic. So this would be a really great one that you can use as a spray. Now, geranium can be a little intense. So depending on the person, maybe you start with a little less geranium. Maybe you go to like 2 or 4 drops of geranium instead of 8, and a little bit of lavender. But we're going to dilute with a carrier oil, just a spray, apply topically. And you can even keep that by the toilet. So every time they go, go to the bathroom, wipe, and then just spray. And it can be really, really helpful for a lot of tools. And then find a pelvic floor PT. I think this is really important, especially if you're having pain with intercourse, pelvic exams, tampons, Maybe you have a hip issue that you've seen PTs for your hips, or a low back issue that's not going away. That could also be a red flag for pelvic floor involvement here. If you're having urinary incontinence or leakage, if you feel like you can't completely empty your bowel or bladder, if you feel like things are falling out, if you have to kind of push your vagina, well, your uterus back up with your finger, or hold your finger in the vaginal canal in order to go to the bathroom or have a BM, like these are all good things to see a pelvic floor PT for. And there's two really great places to go. One is pelvicrehab.com. The other is the APTA pelvichealth.org. So that's American Physical Therapy Association. And you can find a pelvic floor PT in your area, or ask your doctor. Ask your doctor, ask your OB-GYN. A lot of people aren't aware that there are pelvic floor PTs and people that specialize in this area. And we're kind of a rare breed. Not everybody's had this type of training. So know that there might be a 3-month wait to see a pelvic floor PT. So I would start this process sooner rather than later. And in the meantime, this is a really great book to read that's got a lot of great education and information on this as well to kind of help with pelvic floor rehab. But it can be life changing for people to just see a really good pelvic floor PT and find one in your area. And then I was going to briefly talk a little bit, because pelvic floor kind of goes hands in hands with women's health and with our products, but maybe highlight some of these that we love based on women's health and the pelvic floor. Like, we want to make sure that we're taking our VMG plus every day. It helps reduce that C-reactive protein, so an inflammatory marker in the body. Our PB Restore, because we mentioned that our gut health is so intricately tied. Typically, it's not just pelvic pain that patients are dealing with. They also have gut issues, constipation, other things. So this is a great tool. And then our E omegas, it's fascinating. There is some research that shows that just taking a fish oil every single day help to reduce pain and painful periods in women more than taking it over the counter. Now, you got to take it every day. You can't just take it around your cycle, but that can be huge and a game changer for some of your oil customers and clients. The bone nutrient, big fan of this as well, especially for women's health and supporting us. The phytoestrogen complex. And I always want to tell people too, because sometimes I have people that are a little scared. They're like, oh, Laura, I don't do soy in my diet, so I'm nervous about taking this. Please know that this is a fermented soy. So this actually helps to get rid of the xenoestrogens from the body. This is very different than taking like a genetically modified soy. Very different, and shows up differently in the body. So if you're somebody, because we know that soy can be a little estrogenic, this is different. It's fermented. It's actually going to help with estrogen dominance and help with that phase 2 liver detox and support. So this can be a great one. I've seen this help a lot of my clients as well. We love Rose. She's the queen of oils. And something that I want you to think about as we talk about these oils is notice that these flowers look like our female external genitalia. They look like a flower. And it's kind of amazing to me that nature knows, like, these look like what they're going to help us with women's health and hormones. So many amazing things. So use your essential oils to help you too. Use your Claricom. If you had to pick one oil for helping women's health and hormones, Claricom. Apply it, just swipe it along the lower abdomen, like along your panty line. I love doing it on the inside of the ankle bones. That's another point for the uterus that can be really helpful or handy, or just wear it like perfume. I have some women use it like a deodorant. Claricalm is amazing. One of my clients called me this week and she said, Laura, since going through menopause, I really struggle with sleep and hot flashes, and I have 5 Claricalm rollers, and I put them all over the house. And when I wake up, when I can't sleep, I roll it on everywhere, and then I can go back to sleep, and it is amazing. And I just keep it all over the house. And I thought that was fantastic. So this can be really powerful oil to have on hand. And a fun tip, diffuse ylang ylang. And that can be powerful, as well as using Claricalm to just help with hormones if you are, because it's real, right? We can get, the hormones are real. I'm in perimenopause. I'm feeling all the things with you. That can be such a handy tip, as well as use your oils for supporting your mood, supporting anxious feelings, helping to reduce cortisol levels, which is really powerful. These are a few of my favorite, but I always tell people, use which oil speaks to your soul. Pick which oil feels like a hug for your soul and put that in your diffuser. Put it on like perfume. I speak a lot about nervous system regulation. That's really what I do is I help women feel safe in their bodies again. And it's changed how I use some of the essential oils to regulate. And maybe Sandy will let me come back and I can do a whole talk just on pain and the brain and nervous system regulation. But adaptive and Shinrin Yoku are two of my go-tos for that. Of just pause, take a deep breath, inhale. I love to diffuse Shinrin Yoku with serenity at night to help with sleep. It is a beautiful, beautiful combination. So try some different things as well to support your hormones, support mood. And then I think this was a tip from Dr. Hill to fill a veggie capsule all the way up with grapefruit essential oil and take it daily to support normal progesterone levels. I think it comes out to 15 drops if you fill up a full veggie capsule, but that could be something if you need a little extra support in this area to add and try to your daily routine. And these are some fantastic resources. So I love this book. If you haven't read this book, The Essential Oils Menopause Solution by Dr. Marisa Snyder, very good. She's got this protocol for perimenopause, and then she has another protocol for menopause. So depending where you are, and people always ask, how do I use them? Get the book because she has everything. She's got recipes, she's got diffuser blends, she's got rollers. And I love to look at this list. Like, for example, a lot of these we can take internally, play with them, add them to a veggie capsule, put them in your diffuser, find ways to use these oils to support you with wherever you are in this journey. And this is a really great roller blend too that we like. 15 drops of clary sage, 10 drops of lavender, 5 drops ylang ylang, 5 drops of geranium, and then just apply it to your lower back, abdomen, and feet, or use Clarycom. Just depends on who you are. If you want to mix it up, mix it up. If you want an easy button, get your Clarycom roller and put that on. And again, all of these things are going to work best when we do them daily. It's like weight training. We gotta go and we gotta put in the reps. Same thing with taking our VMG Plus every day, our foundational wellness supplements every day, diffusing. I really look at diffusing as the aromatherapy and emotional support, just as important as taking my foundational wellness supplements. It makes a really, really big difference. Hot flashes. Do a spray. So you can do 20 drops of peppermint, 10 drops of clary sage, a tablespoon of witch hazel, top with your distilled water, shake it up, spray it when you need it. This is so powerful. A lot of you are still in places that's still hot right now. I am in West Texas. So using our spray can be really helpful too. Just some little tips to kind of have on hand. And then liver support's really important, especially when we have an estrogen dominance situation. So estrogen's kind of the building up hormone. When we have too much estrogen is when we have things like endometriosis, ovarian cysts, fibroids, things. So the more that we can support healthy liver function and balancing our hormones, the better. So drinking your water, do your recharge, add some lemon in there. You could do your Zendocrine. I love the Zendocrine soft gel and the complex. So they're a little bit different. I like both. The Zendocrine soft gel is our Zendocrine essential oil. The complex has different herbs and botanicals and things in there to really, really help support your liver. So both are really powerful, especially if you know you need maybe a little bit of support in that area. If you need a little bit of support for your pancreas, the MetaPower soft gels are amazing, again, for metabolism support, blood sugar support. The Assist helps assist in breaking down carbohydrates. So this is where you could take this maybe 10 to or 15 to 30 minutes before a meal. But I always have people say, oh, I forgot to take it. Take it whenever you remember. If you already ate your meal, take your Assist, add that in. If you're somebody who really struggles with this, you can do it 3 times a day. And they even came out with the bigger bottle of the Assist to help us with that, with the 90 to take it 3 times a day. So you can kind of play with this a little bit, but we have really cool tools to help with hormones, because if we can balance our blood sugar, it's also going to help with hormonal support. Everything kind of works together. And then for adrenal support, I love Magnolia. This is a really beautiful oil. Just roll it over your adrenals. So the adrenals sit like little hats on top of our kidneys in the lower back area. Just roll that on. Use this as a perfume. Magnolia has more linalool than lavenders. This is also a really beautiful one if you want to roll it on the bottoms of your feet to help with sleep. And then we've got our Mito 2 Max. which we love with that's got the PQQ, which has tons of different health benefits there. It really helps with that mitochondrial production, with that energy, without the caffeine and the stimulants, which is a really beautiful one too to kind of play with. So these are really nice to add in. And then supporting our thyroid. So you can make a roller bottle and do 10 drops of each of these: clove, myrrh, frankincense, and lemongrass, and then top with your favorite carrier oil and just apply that topically right over the thyroid, kind of over here. It's the little butterfly on our neck, and do that 3 times a day. And I always tell people, put the oils where you're going to see them and use them. So maybe keep this on your bathroom counter by your toothbrush so you can roll it on your thyroid and keep your Clary-Calm right there, and you can swipe it around your ankle bones and your lower abdomen. We want to make the oils work for us by habit stacking so we've got cues. And then these are such great books. Highly, highly recommend them. Women's Bodies, Women's Wisdom by Dr. Christine Northrup. I feel like this is the guide. This is the roadmap for being a woman. I have it in book form, and then I have it on Kindle on my phone so that I can access it anytime I need it. It is a fantastic book. I love the Essential Oils Hormone Solution as well as the Essential Oils Menopause Solution by Dr. Marisa Snyder. And then the Period Repair Manual by Laura Bryden is so, so good. These are really, really great books. And then don't forget our Symphony of the Cells. We love our Symphony of the Cells. There's a whole hormone balance support technique there. And there's something really powerful about touch and applying the essential oils. And especially as women, I think we're quick to come to and support everybody else. And we also need to be poured into too. And this can be really beautiful. And if you don't have somebody who can do this on you, apply the oils to your lower back as best you can and bottoms of the feet. Do the best you can. Putting some oils on you is going to be better than nothing. Ideally, find a friend. Maybe you do it on each other. Find somebody to help you and support you with that. But it's beautiful. We love, love, love the Symphony of the Cells. And then this is just an example of a rewards order where we're going to really support women's health and hormones to have there. Start with your foundational wellness supplements. They're foundational for a reason. And then if you need a little bit of liver support or a little bit of adrenal support or hormone support, we can play with these, and you're going to get your shaker bottle, your peppermint oil, the free oil of the month. You're going to get free shipping. Like, I love that doTERRA has all of these amazing perks for us that helps us save and supports our health and wellness. And then this is me. If you have questions from this talk, I'm in all the places. You can find me on Facebook. I've got an education group on Facebook that's open to everybody, Learning with Dr. Laura. I'm on Instagram. I tell people I'm the most fun on Instagram. Like, that's where I hang out a lot. That's where you'll see my husband and I dance and do the things. But I'm also on YouTube. I've got over 800 videos on YouTube on lots of different things. There's my email, there's my website. But if you have questions, if something comes up, or you're watching the replay or something, like, please let me know, because I'd love to hang out and just connect and be able to support. Oh my gosh, I feel like we talked about a whole lot of stuff because I also wanted to leave room for Q&A. So that was
Dr. Laura,
good.
before we wrap up, do you want to spend just a minute or two or three on the glow up?
Yeah, let's talk about the glow up. So the Glow flash sale, it ends at midnight tonight, as Sandy mentioned, which is so fantastic. And I have the recharge right here. I've got my little drink right here, but it is our recharge electrolyte, our PB Assist Plus probiotic, and our MetaPower Advantage collagen. And what makes it so different is our MetaPower Advantage collagen. I had somebody ask me today, is this like Vital Proteins collagen? And I said, no, it's better. Like, Vital Proteins just has 2 types. Typically, this is most collagens on the market. They're going to have a type 1 and a type 2. Our Advantage has 9 different types of collagen. It is a marine-based collagen. It has the tripeptides. What does that mean? The body is actually able to break that down and absorb it. And that is huge. doTERRA does a really great job of going above and beyond to make sure that we actually absorb and get to utilize the things that we take. And then it takes it a step further because I kind of think of it as an anti-aging collagen because we have the NMN, the NAD, the vitamin C. So this is something that is not only great for our joint health and when we think about bone health, joint health, but also hair, skin, nails, anti-aging, supporting us from a lot of different areas. Now, when we mix it with water is when it becomes bioavailable. And so it's something that you want to get down fairly quickly, like within 60 to 90 seconds. Maybe not something that you just want to sip on all through the day, but take it, mix it up, that activates it, drink it down. But you do not want to add that to coffee. You do not want to add that to like a hot liquid. You're not going to get the bioavailability with it, but very powerful. Our electrolytes have 4 different types of magnesium. So we were talking about how much constipation affects the pelvic floor. Like it's miserable when you can't have a bowel movement. So 4 types of magnesium in here. So I think about people with head tension, people who are backed up that need a little bit of extra support here. It's got this baobab extract, which is, I think, a plant in the desert, and it helps with this cellular water transport. So basically, it's super cool and very hydrating to the cells. Now, a lot of the other electrolytes, like a lot of people hear about Element, is kind of the really popular one, and it's super, super salty. That was specifically designed for high level athletes who are using it. Ours is for everybody. Littles, toddlers, like everybody in your family can drink this. It is safe. If you are a high level athlete, awesome. You can double up on this. You can take more. But this has a lot of extra benefits and really looking at actually hydrating the cells. And Alex DeBell, I got to hop on a Zoom with him before as we're prepping for this Terra Talk. I can tell you the Alex DeBell that you see on the stage is the exact same person that you see in real life. Like super, and I'm here for it because I love the research and the science. But he even added ginseng. They're adding specific things to this to really help with ATP, with energy production, and with being very hydrating. Because people think hydration is water. It's actually water plus minerals. So they did a really, really fantastic job. And it's a liquid liposomal for better absorption than a lot of the powdered electrolytes that you see, which is huge. And then our PB Assist Plus is our probiotic, and it is encapsulated. And that is very, very important because the acidity in the stomach, because of the hydrochloric acid, it's very high. So if you're taking a probiotic that isn't encapsulated, which basically means it can kind of protect it through getting through that high pH and the acidity of the stomach to actually get into your gut where you need it. So if you're not taking one, which a lot of them are not, it's just dying off in the gut. You're just wasting your money. You're taking a probiotic and the stomach is, the buck stops there. So that's huge that it can actually get to where we need it. It's got multiple probiotic strains, I think 13, somewhere around there. It's perfect for travel because you don't have to refrigerate it. And it tastes yummy. It's a strawberry melon flavor. It tastes like a pixie stick. My husband doesn't love swallowing pills, so we really love the new updated foundational wellness. He loves his VMG. He loves to just chew his fish oil instead of having to swallow it. And he calls the PB Assist Plus his candy. So he's a big fan. But they all taste really yummy when you mix them up into a drink and take it. So that is our glow shot. These 3 powerhouse products, and hopefully that helps a little bit because I always want to know, why is it different? Why is it different than the stuff at the grocery store? And also the stuff at the grocery store, we can't really absorb it. We're not getting points back. We're like, eh. But that makes a really, really big difference. And you can take it separately too. And you can take more recharge. You could take multiples of these throughout the day to support you as well. So listen to your body and play with it. But the Glow bundle is awesome because you're getting it all at a discount and it ends tonight at midnight. So go put that as your, if you've already did your rewards order today, do it as an instant rewards order so that you get all your points back with everything and save.